Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
So hello, everybody. Here we are back with another exciting ZOOMERTIMES TV interview. And I've told people I really enjoy this. I probably enjoy this more than almost anything I do because I get to talk to great people. If you're not great, I don't even want to interview you. So just know if you're interviewed, you're one of my special people. And before I do, though, that I do want to talk about an organization that I think is so important. It's called Faith Farm Industries and Ministries, actually, Faith Farm Ministries. And they are probably the most, I should probably not say this, but for me, they're the most important charity that I deal with because I know the good that they do. They take care of over 400 people every 10 months, free of charge. They give them food, they give them a house, a place to live. It's a great organization. So Faith Farm Ministries, they're in Fort Lauderdale and in Boynton Beach and in Okeechobee. Remember that. And when you want to give, buy furniture or give furniture, please call them. And that's faithfarm.org. And it's really a great place. Okay, so now today we have our one of our most special interviews. We always love talking to Cynthia Meacham because she not only is so enthusiastic and just a fun person to talk with, but she is doing something extremely important. When you're on Medicare, when you're just getting on Medicare or you're on Medicare, so many questions about your health and how you can get the best Medicare insurance. And it's like a one-stop shop that you don't have to listen to a lot of people calling you and trying to tell you, oh, come with us now. Cynthia will tell you after she interviews you what she believes is the best Medicare organization for you. And so welcome to our show, Cynthia. I know it's a long introduction, but I believe that about you.
Thank you so much, Anita. I appreciate that.
So Cynthia, in your advertising in ZOOMERTIMES, you do show something that says your free discount RX card. What is that?
There's a lot of discount cards out there, and you maybe even have heard of a few, but what that does is a free card, and it's not even just for Medicare recipients, it's for everybody. And it's free, and it helps save them up to about 80% on some of their prescription drug coverage. So what you can do is just give me a call and I can look it up for you. If it's going to save you anything, I will send you over the card. Even if it's not going to save you anything right now, you might as well get it because it's free and you never know what prescriptions you're going to get in the future that it may be able to help you with.
So when these companies have prescriptions, they have certain prices, but then why do they give certain discounts, or who do they give them to?
They're in partners. GlycosRx, the one that I'm speaking of, they're in partnerships with all the different pharmacies around. So they have negotiated rates, so that way they're able to help save people a little bit of money. Anita, have you ever had any friends that complained about their prescription drug coverage?
Oh, all the time.
And what do they usually do about it?
Suffer.
See, and there's so many different things that you can do. The first thing is you can always also call the pharmaceutical companies because a lot of times they have manufacturer coupons that they're able to give you. Your doctor's office, also, you can always talk about either a generic form of it or sometimes they have samples. So a lot of times people hit their donut holes and they have these really expensive medications. So sometimes their doctors actually have samples, which kind of hold them over so they don't have to pay all that. Another thing that they can do is LIS, which is low income subsidy. And all they have to do is call Medicare Social Security. And depending on their income, they may be able to get help pay for their premiums, pay for their co-pays and all that good stuff. So they're a really good option as well. So there are options. And then of course, call me because all of these plans that I represent have all different formularies on there. So with what you're paying right now, you could be saving a ton with another company. So that's why it's really important to call me so that way I can go through it for you and make sure that you're in the best plan, saving the most money.
Wow, this is like
Yes.
winning the lottery, talking to you. It's really important. Thank you. That's it.
Yeah.
People don't understand, if you're not working anymore and you're on Medicare or Medicaid, or that even paying $10, $20 for a prescription is a lot of money. It could take something else, paying your electricity, you can't pay this or that. My guest is Cynthia Meacham, and she is the senior services representative for North America, and I have North American Insurance. Let me just say that we've had Cynthia on before, and the nice part about this whole thing is what I said. There are many facts out there. Some are not the right facts. Some you hear from your neighbors. You're sitting at the condo pool and they say, no, I'm with this company and you ought to be with this company. But that's not what Cynthia does. She is an expert. She has communications with all these insurance companies for Medicare. It's really the Medicare population, isn't it? That's what you handle.
That's my specialty. That's who I love to deal with, is the seniors, and that's why I represent all the companies. So that way it's an unbiased, what I'm giving them, what I think that is best for them. I'm going to look through and make sure that they're on the most comprehensive, affordable, suitable plan for them. And if they've been on a plan for a while, they probably don't even realize that there's companies out there that are going to give them better benefits, better prescription drug coverage, smaller copays to the hospital, to see their specialist, and so on. So it's really important, and it doesn't cost them anything. So why not give me a call and let me make sure that they're in the right plan still, because they change every year.
Oh, okay. They change every year. Now, about how many plans are there? I mean, are there 2 or 3 or a lot?
There's over 40.
Over 40 plans?
Yes, there's over 40 plans to choose from. So instead of them looking at this, you can go to medicare.gov and you'll see all of them pop up. So instead of them I don't know what to do, or flipping through all of them and making sure who has my doctors, what's this prescription drug, call me. I have a great little system. I put everything in my computer and voila, it's done.
Great. Oh, Cynthia, we're so lucky to have you work with us. I can't tell you, that's, it's you haven't really been sitting around a condo pool with all the seniors talking about these things, because the most important thing, as to seniors, is health and wealth. And they want to know, what they can do to get the best health care, and then about wealth. And what I will tell you this, that you're the founder of your company has a free health and wealth series. And I'd like them to be able to call. They're going to call your number. It's 954-802-0738. And repeat that, 954-802-0738. That I've really attended his Joe's seminar. It's really outstanding. It's fantastic, as a matter of fact. And I certainly hope, and it's free. And if you call Cynthia, she'll get your name on the list to be able to attend that seminar. It's all done, I think, on Zoom, isn't it?
It is. It's very easy. It's usually about a half an hour, so it's not too long, and he gets to the point and make sure that everyone is going to be financially secure, because that's health and wealth is what everyone at the end needs to make sure that they have here.
That's right, the health especially. But let's now go into some of the little issues here. So in your ad, you say explain the parts A, B, C, and D. Now those are just letters. People who have been on, as you said so smartly, sometimes people were on this now for 5 years. They still don't remember, they don't know. They could just call you and you could give them a refresher course, I think.
Absolutely. Just have them give me a call, and we'll just even if I'm not their agent, I represent everybody, so I'll know their plan. And that's people call me all the time just for that. Oh my gosh, what's my copay for this, or what's my copay for that? And I have no problem helping them out with that. That's no problem. And that's what's so great about your publication, Anita, is that you have so much information out there to all of these seniors, that it's so great now that they have that, and they're able to have something to read every single month and get more information about what they should be doing.
Right.
So it's great.
Thank you. Yeah, thank you. Well, we try hard, just like you do. So let's just take this other thing. Now, sometimes people, they get on Medicare and they choose between a Medicare Advantage, that's the one thing. There isn't a plain Medicare HMO, is there? It's an HMO Advantage or supplemental. Are those the only two opportunities?
No, the Medicare Advantage also has PPOs in them as well. And they also have fee for service. They have a few different things. We've talked about the dual Medicaid, Medicare plans that are in Medicare Advantage, the chronic plans, you know, if you have any chronic, you know, heart disease, diabetes, or anything like that, there's plans for them. And they're not all HMOs. Some of them are POSs, some of them are PPOs. So they're able to use it nationwide. So it's huge for them. And they don't realize that sometimes people are paying a supplement and now thousands of dollars and they're not using it at all. So another option for them would definitely be a Medicare Advantage plan.
And so what if they are like, they come down to South Florida and they go back up north and maybe they go somewhere else? Does that insurance take care of them everywhere?
It does. And that's what I make sure. I make sure where they're traveling, I take that zip code, I put it in, and I'll tell them if their doctors are covered, what hospitals in that area are in network and whatnot. But keep in mind, even if they're not in network with the PPO, they're able to go out of network and still get benefits. It's usually at a higher cost, but they do have that option as well.
Mm-hmm. So the, you know, when I was first doing all this, it wasn't an HMO Advantage. It was just HMO. Is that all gone now?
Now the Advantage plans have so many different options that no, it's not just all HMOs. Correct, stand corrected. There are some plans, Medicare Advantage, that only have HMOs within them, but your United Healthcare, Aetna, Humana, they all have PPO and HMO, so you can choose which works out best for you.
And so some of them are national plans, and some plans are like, I know that Simply, they advertise with us. I didn't think they're anywhere but in South Florida, are they?
That's correct. Simply is one of the plans out there that are strictly an HMO.
Oh, so but
they're great.
I see.
Yes.
So it's an HMO. Okay. And then there's the Health Sun. And what is that? The same thing?
That's the same thing. They're actually a 5-star plan. They are actually an HMO as well, only within, you know, the state. And when you have an HMO, you can most of the time only see doctors in your county.
I see.
Yes.
And then the other thing that I think is really important, and I'm always confused by it, when people want to change, what are the dates that they have to change? Just tell us, and then I'm going to ask another question.
So if they don't want to change and there's no special election period going on, they haven't moved or been taken off of a group insurance or anything like that, that's during AEP, which is right around the corner, and that's October 15th through December 7th. And they can change as many times as they want within that time. The last application to go in is the last plan that they're going to be with, and that's going to start for the next coming year. So this AEP will be in 2022.
So sometimes I see where they extended into January or February, and I was confused about that.
So that time is called OEP, and that's open enrollment. And what they can do during OEP is if they've made a change during AEP, they have one time, January through the end of March, to make one change. So if they're not happy or they thought it was something else, they do have another opportunity to make one more change.
I see. And is that something you can help them with, or do they have to do that themselves?
Absolutely. Nope. Just give me a call.
And do you actually call the company to help them do that?
Oh yeah, they just like through AEP, I'll get all their information, go through all the plans, and then let them choose, you know, which is best for them.
I see. Because you see, that's the hard thing, that they get into something and then the people maybe try to convince them to stay. And they really need a second party, someone else to fend for them, I think.
Absolutely. So all they have to do is give me a call and I'll review everything. And if they didn't make the right choice, or if they were persuaded into a plan, or if their friend told them, you know, Simply Healthcare is the best, but they travel a lot, that's probably not the best plan for them. So they have options, definitely. And I'd love to go over all of them, and it's all complimentary. So you might as well make sure you're in the right plan.
it's very important that you said that. They say, well, there must be a trick. Why does she do this for free? So what's the trick?
There's no trick. You know what? If I help you out now, I know somewhere down the road, you're either going to remember me or one of your friends or family members, and you're going to say, oh, wait, I have somebody. And it all comes back. You put good out there, Anita, and it all eventually comes back, right?
Right. Yeah, that's good, because that's so important that, nowadays something is free, but it's really not free. But you have helped a lot of people, and I know that, and makes people feel comfortable. Actually, just talking to you would make people feel comfortable. You're so enthusiastic, and you've been doing this for a long time. I get in my brain that you've been doing this for 12 years. Is that what you once told me?
2006.
15. Oh, goodness.
Yes.
Yeah, so you know a lot. And of course, as you said, things do change. Like I might get a notice of something I'm in, and it changed. And then the next year it changed. But
Changes.
they just called you, or do you have them on a list, and when things happen, you call them back? How do you do this?
Well, with my clients, every single year, I call them, starting September, to see if they're happy. Are you happy with your plan?
Oh.
I know you've gotten, your changes, because they will, email them, or not email them, but send something in the mail about any changes of their plan. So I want to make sure they're happy. If they're not, or they see something on TV, this commercial came up, what's this? I look into it all for them.
Oh, wow, you're this spirit just running around. You're a busy woman. I can see that. That's not casual, trying to keep people, in tune on all their insurance needs. It's insurance is probably the most confusing process that anybody has to deal with. It is. I mean,
it is.
They get an insurance policy, and they think that they're supposed to read it. There's no way they're going to read that. They need to have an interpreter like you, right?
Absolutely, absolutely. Or even not even further so, if they have it and they're getting claims, or they have to pay for something that's covered, they can always call me, and we'll work it out with customer service. We'll give them a call on three-way sometimes if I need. They always have someone to at least call. I'm always going to pick up my phone and be able to help you out the best I can. So it's also good to have a broker.
Great. You do a very, very fine service. The number again is 954-802-0738, and it's Cynthia Meacham. And Cynthia is like having, it's almost like having a grandchild who looks up everything for you and helps you. Are you getting them on? Are you helping them on the computer also, Cynthia, or is that something else?
Nope. I mean, we'll try, but sometimes it gets a little confusing. But for the most part, everyone's pretty tech savvy these days,
Really?
So,
that's good.
And if not, then we can always meet in person, as long as they're comfortable with me in a mask and they're in their mask, and we can sit, a little bit away from each other. I have no problem meeting in person either.
Oh, that's interesting. We've never talked about that. So even before COVID, you used to meet with them in person, I'm sure.
That was like 90% of my business was in person.
Really?
Yes. And even my clients now that call me, they say, no, Cynthia, we want you to come over. Just wear your mask. We'll wear ours and come over and see us. So they still prefer me to be there in person.
Oh, so this isn't just a call. This is meeting with somebody, going over their paperwork, and then, I'm sure they feel so much better. I'm glad we talked about that, because yes, as long as people are masked and they've had their vaccines, you shouldn't be afraid of it. And so you will sit with them. You probably, and you do this in their home, or you could do it anywhere, actually.
I do it in their home most of the time, but also sometimes we'll meet at coffee shops, Dunkin' Donuts, Starbucks, whatever is close to them and they feel most comfortable with. We also have an office in Delray, so if they want to come to our office, they have that option too. Whatever they're comfortable with.
It's wonderful to talk to you, because the owner and founder, Joe, is he has places like this, and people, I don't know if they're as good as you, but people all over the country doing this.
Absolutely. They are just as good as me. He trains us, and he does such a good job that, I mean, he that's why his business is so successful, because he really gets down and trains us and makes sure that we all know what we're talking about, the ins and outs of Medicare, and he's always a call away too. So that's the best part. If I ever need anything, I just call him and he's there. So
Amazing. That's really great. Well, before he called us, I didn't know about his company at all. And of course, after talking with you, it's like a 5-star company. I mean, I just have to tell you, you are really a star here in a field that's very tough. I mean, I have been, as a gerontologist, I have been knowing about when it was just Medicare and before, and then I remember my father when it was HMOs, he'd have 1 week, he'd have this HMO, and the next week he'd have a different HMO, and then another HMO, because they kept giving prizes. If you buy this, you get a toaster, you do this, you get that. And I never knew who it was that he had. So I guess that's really why they went to they said there was a certain time that you could have it and you couldn't take these seniors and confuse them, right? That's what was happening.
Right. 100%. 10 years ago, it was not regulated as it is now. And unfortunately, things like that were happening and everybody was really confused. So now, like I said, before I even talk to you, I need to have a scope of appointment filled out that says exactly what we are talking about, what companies we are talking about, and what plans we are talking about. So that way, no one's confused anymore, and it's very, very, very regulated. So that's really good. They put us through a ton of training annually to make sure that that does not happen.
And so the HMO Advantage plans, they don't have to really write a check every month for it. This is not the same as if you have some other plans that you discussed.
Even those other plans, the PPOs are usually a 0 premium as well.
Huh. So this is the government's commitment to help the seniors with their health care, which is extremely important.
I agree. And it's getting better every year. Every year when I say plans change, they always change for the better. There's more benefits added in. There's more drug coverage. I mean, they always get, every year I'm like, oh, this can't get any better. And the next year it does. So I can't wait till I turn 65 and I can get Medicare because it's a lot better than what I have.
Right. Well, but I guess because there is competition, if there were only 1 or 2, they wouldn't have to do that. But as you said, there are 40 opportunities. Well, everyone has to have something better so that the person, says, well, maybe I want to go with that, right? But of course, you have said before, which is really important, you make sure that the doctors who they like or they go to now are part of the plan. Because that's
most important.
Isn't that the most important?
That's the most important. Absolutely. Especially like their primary care that they've been seeing forever. They don't want to change now, not in your 60s and your 70s. Your cardiologist. So that's the number one. Make sure the doctors are in, your hospitals are in, and your medications are being covered at the lowest, So those are my 3 biggies that I need to pick through first to find out which company to go with for them. And if they travel.
Yeah. The other thing I was thinking too, is you were saying that, what about the idea of a doctor now who leaves? Now they've left, and now they have to get another doctor.
Well, the beauty of what I do is, depending on the company, the doctors are rated within them. So I can even go through, put in their zip code, and see who's 5-star doctors, because they're all rated by, yes, they're patient. So I'm either to go through and say, oh, male or female, because they usually have their preference, and then I can go through and see who has the highest star rating on the doctors. So that's also another benefit that they may not know on their own that I can help out with.
Right, that's great. Well, I guess all good things have to come to an end, and I just want to tell everybody to remember to call Cynthia, and her phone number is 954-802-0738. And you'll get the best service you've ever can even dream of, and it's all for free. So thank you, Cynthia. We really appreciate you doing this.
Have a great day.
Okay. And I just want to tell everybody, when you get Boomer Times, be sure to go to the resource guide, because it's like a yellow pages. You'll see a lot of companies and you'll get some names and phone numbers. And I think that's something that could be very helpful. So, okay. So we're going to talk to you another time, Cynthia.
All right, Anita. Bye-bye.
Bye.